And 4 months ago, on March the 1st, coronavirus situation was about this. At the end of February, there were 79,000 cases around the world, only 14 in the United States, except for 39 who'd been brought home from overseas with the virus. By March the 2nd, there were 2 deaths in the United States. By March the 3rd, when we had a hearing, there were 6 deaths. And on March the 1st, on Sunday in the New York Times, on the front page it said this, that most experts were far from certain that this virus would carry to all parts of the United States, and that with its top-notch scientists, quote, modern hospitals and sprawling public health infrastructure, most experts agree the United States is among the countries best prepared to prevent or manage such an epidemic. Well, even 6 weeks after the first virus was found in the United States, even the experts underestimated the ease of transmission and the ability of this coronavirus to spread without symptoms. These qualities made the virus, in the words of Dr. Fauci, my worst nightmare. In the period of 4 months, he said, it has devastated the world. This committee is holding this hearing today because even with an event as significant as COVID-19, memories fade and attention moves quickly to the next crisis. While the nation is in the midst of responding to COVID-19, the United States Congress should take stock now of what parts of the local, state, and federal response to this crisis worked, what could work better and how to be prepared to pass legislation this year to be better prepared for the next pandemic, which will surely come. On June 9, I released a white paper outlining 5 recommendations for Congress to prepare Americans for the next pandemic. They were these. Number 1, test, treatments, and vaccines. Accelerate research and development. Number 2, disease surveillance. Expand our ability to detect, identify, model, and track emerging infectious diseases. Number 3, stockpiles, distributions, and surges. Rebuild and maintain federal and state stockpiles and improve medical supply surge capacity and distribution. Number 4, public health capabilities. Improve state and local public health capabilities. And finally, who's on the flagpole? Who's in charge? Improve coordination of federal agencies during a public health emergency. I've invited comments and responses and any additional recommendations for the Senate Committee on Health, Education, Labor, and Pensions to consider. I will share this feedback with my colleagues both on the Democratic and the Republican side. This is not a new subject for any of the witnesses that we have today. 15 years ago, the then Majority Leader of the United States Senate, Bill Frist, said in a speech at the National Press Club that a viral pandemic is no longer a question of if, but a question of when. He recommended what he calls a 6-point public health prescription to minimize the blow: communication, surveillance, antivirals, vaccines, research, stockpile surge capacity. Senator Frist is one of our witnesses today, and I'm including in the record 2 of his speeches. Our next witness, Dr. Jonae Caldoun, serves as Chief Medical Executive and Chief Deputy Director for Health, the Michigan Department of Health and Human Services, where she's worked to coordinate the state's response to COVID-19. A third witness is Dr. Julie Gerberding, who served as Director of the Centers for Disease Control and Prevention under President George W. Bush. She helped lead preparedness efforts and the response to SARS, West Nile virus, H5N1 avian influenza, and the rise of multi-drug resistant bacteria like MRSA. Another witness is Governor Michael Leavitt. He was governor of Utah. He was Secretary of Health and Human Services and administrator of the EPA under George W. Bush. Following the emergence of the H5N1 avian flu, Governor Leavitt increasingly focused his efforts on pandemic preparedness. As secretary in 2007, he said this 13 years ago: "Everything we do before a pandemic will seem alarmist. Everything we do after a pandemic will seem inadequate." That's the dilemma we face, but it should not stop us from doing what we can do to prepare. Congress has passed legislation to prepare for pandemics before. During the last 20 years, 4 presidents, Clinton, Bush, Obama, Trump, and several Congresses have enacted 9 significant laws to help local, state, and federal governments, as well as hospitals and healthcare providers, to prepare for a public health emergency, including a pandemic. Congress provided over $18 billion to states and hospital preparedness systems over the last 15 years to help them prepare as well. In writing those laws, Congress considered many reports from presidential commissions, offices of inspectors general, the Government Accountability Office, and outside experts. The reports contained all sorts of warnings that the United States needed to address the following familiar issues, familiar by now: better methods to quickly develop tests, treatments, and vaccines and scale up manufacturing capacity, better systems to quickly identify emerging infectious diseases, more training for the healthcare and public health workforces, better distribution of medical supplies, better systems to share information within and among states and between states and the federal government. Many reports also warn that while states play the lead role in a public health response, many states didn't have enough trained doctors, nurses, and healthcare professionals, had inadequate stockpiles, and struggled with funding challenges. In some instances, over-reliance on inflexible federal funding contributed to these problems. Looking at lessons learned from the COVID crisis thus far, many of the challenges that Congress has worked to address during the last 20 years still remain. Additionally, COVID-19 has exposed some gaps that had not been previously identified. These include unanticipated shortages of testing supplies and sedative drugs, which are necessary to use ventilators for COVID-19 patients. Memories fade. Attention moves quickly to the next crisis. 5 months ago, we were in the midst of the impeachment of a president. Today, that seems like ancient Roman history. That makes it imperative that Congress act on needed changes this year in order to better prepare for the next pandemic. I look forward to hearing from our witnesses, and I also appreciate the feedback we're receiving on the white paper. I've set a deadline for June 26 on that feedback so the committee has time to consider it and to draft and pass legislation this year.